My name is Dominic Ward. I'm British. I've had a knee problem since the 1980s. It's gradually got worse and worse. I spent my whole life playing competitive sport. It looked after me through all that time, but the injury got too serious. And because the injury's been there for so long and unfortunately tilted my back and then caused problems with my right hip and therefore damaged the right hip, both of which needed replacing. And having read a number of reviews and looked at a number of different hospitals, then Apollo came out on top for me. I was sure that it was a hospital I could trust. We were able to get a date fixed, and really then the door was wide open for me to come over here.
Mr. Christopher, he contacted rather on telephone from Australia about his problem in the hip and the right hip and the left knee, because he had been suffering for a long time, since about 1980, after injury to the left knee. He had undergone one surgery also before coming here about his meniscus tear, which was done in about 1998. So, but still after that surgery, he was not improved.
But then all the follow-ups, when I was asked to get different tests done, different blood tests, heart tests, all sorts of things that I was requested to do to supply information from Australia through the Australian National Health. And I provided all that information. I sent it across to India. And there were questions about that. There were some discussions, but I think the conclusion that I needed to have a knee replacement and hip replacement came about quite quickly.
After looking all these investigations and all, so that he would need a total hip replacement of the right side and total knee replacement of the left side. Once we finalized all the things online, everything, we got investigated and found him fit physically. So we decided that he should come here and get admitted and get the procedure done.
The people I found here and the way they dealt with me and the response was so fantastically service-focused, help-focused. The whole process was made so lovely and so easy because of that.
We did his right hip replacement first, followed by left knee replacement, the same sitting. So subsequently, the post-operative period was uneventful. There was no complication. He was comfortable. So he started with the physiotherapy the next day of the surgery. We made him to stand on the second day of the surgery. With walker, he was able to walk. Dressings were changed. Wounds were found all right, and they were healing.
At the very end, I think I was told that everything had gone well and that they were happy with which is always lovely to hear right at the last thing. It's always, you've always got these fears going on in your head as to what might happen. So hearing that was nice.
And he's doing exercises. His functionally left knee and the right hip are coming back to normal. So he's doing well. We wish him all the best, and he is now going to Australia back, maybe in 2-3 days' time. So he'll be in touch with us.
All of you have done such a fantastic job. You've done all your parts, and I just think now it's for me, when I go back to Australia, to play my part. And on the ward, all the nurses at the nurses' stations, all the people that came in, the people that brought me food, the people that cleaned the floors, everybody was so friendly, so helpful, and did such a great job. And were constantly asking me, is it okay? Are you getting what you want? Are you getting the right food? Do you need anything better? Do you want to change that? Do you want to change this? That service level was totally and utterly impeccable.